Hello and good afternoon, and welcome to this PANACEA Virtual End User Workshop webinar on Cybersecurity Governance Model. We'll be hearing today from our experts who've been developing this new approach to governance and organizational aspects of risk management inside a hospital or healthcare structure. And this is part of a series of webinars we're doing, started yesterday and continuing up to the 24th of September. It's now my pleasure to introduce you to Dr. Sabina Magalini from the Gemelli University Hospital, who will be giving us a welcome. The floor is yours. Thank you, Sabina.
Sorry, Stephanie, maybe we can wait some minutes because I see that there are only three attendees.
Oh yeah, okay, we'll just wait then just a second. Let me just reshare my screen. So there we are.
How many are we expecting?
Many more.
Yeah, quite a few more. Yeah, here's another one coming in. So just for everyone joining us, we're just waiting a little bit longer for other participants to join us.
Hi there, can you hear me?
Yes.
Yeah, it's Paolo speaking. Morning to all.
Hi, Paolo.
Good afternoon, Paolo. We have actually started broadcasting the webinar, but we're just waiting for a few more people to come online before doing Sabina's welcome speech. Okay.
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 Thank you very much.
So just for the participants coming in as external advisors to this workshop, we will be doing a short presentation with you all after the welcome speech, when I've just showed everyone the agenda of the day, where we will be asking you to give us your name, affiliation and interest in PANACEA. So, but we'll just wait a few more minutes before continuing so that we can have a few more attendees online. Thank you. Well, I think perhaps we should start now anyway, and we'll see, hopefully a few more people will be joining us soon. So I'll leave the floor to you, Sabina. Okay. We can always do a recap before we go into the interactive sessions later on.
Okay.
People come.
I just wanted to give a welcome to all of you who are participating. My name is Sabina Magalini and I'm an emergency surgeon of the Policlinico Gemelli of Rome. Our hospital is coordinating the PANACEA project that has the aim to deliver a set of people-centered cybersecurity solutions for healthcare. And so in my role of project coordinator, I would like to welcome you to this second session of the second end user workshop, which has the intent to have feedback on the tools we are building. As you know, this workshop deals with one of the solutions today, the Cybersecurity Governance Model. We thank all of you who are participating for the precious time that you will dedicate to us and the extensive experience that you are bringing to these workshops. All your suggestions and evaluations that you will offer will be put to good use to fine-tune the tools we are designing to help hospitals and cybersecurity in these difficult times. Thank you and have a good workshop.
Thank you very much, Sabine. I'm just going to reshare my screen now with the agenda. We'll just run through the agenda briefly. So what we'll do now is to talk you quickly through how the session will be structured this afternoon. So we're going to start next with an introduction with our participants, so that we're all aware who they are and why they are interested in PANACEA. Then we'll do a couple of quick live polls on the stakeholder profiling. These are quite straightforward and we should be able to get through them pretty quickly. Then Pasquale Mario from the Gemelli Hospital as well will introduce you to our presenters this afternoon, and then they will give their presentation, and then after that we'll move on to the interactive part. This starts with a Q&A, which we can do actually also during the presentations themselves. And then we'll have some sort of interactive feedback with some further live polls on your viewpoints on what you see presented this afternoon. And then we'll wrap up with a few next steps from Pasquale. So let me just put on the list of participants. We know that not everyone is online, but I think we can start with Christos as well. I know I see. Oh no, Socrates. No, Christos. I know that you're online. If you'd like to unmute and introduce yourself, or we unmute you and you introduce yourself.
Hello, I'm Christos Danos from the National Technical University of Athens. I'm representing the Sphinx project from the side of the coordinator, who is NTUA, and I'm interested in finding out the results of PANACEA, as we are using also similar techniques and similar opportunities to integrate the results of both projects and other projects that are related also to the same subject matter together to form the new way that we are going to be dealing with cybersecurity in healthcare.
Yeah, thank you very much, Christos. The next on the list is Caston. We know we also met you yesterday. Thank you for joining us again this afternoon. The floor is yours.
Good day. Thanks for having me. Yeah, I'm still here again to get more information about the governance model within cybersecurity, because we're working on cybersecurity risk management together with Manos from the University of Greenwich.
Thank you very much, Caston. And the next person on the list should be Ramon. Here we have a hospital, so the floor is yours, Ramon, for a quick introduction. Can we unmute Ramon?
Yes, Ramon, I already unmuted your microphone, so you should be able to talk if you wish to make a short presentation.
Maybe we have a problem with the mic here. Well, I suggest we move forward. We can always come back to Ramon. Will be talking interactively later on. And it's my pleasure then to pass the floor to Pasquale and to our colleagues from Aon. So the floor is yours to start the presentations. Thanks very much.
I can see the next slide. Thanks, Stephanie. Now we start with the presentation of. I can't see the screen. Okay. Okay, we started with the introduction of the presentation of the tool. The presentations will be done by Claudia Pani, Raniero Rapone, and Maria Rosaria Cioffi. They are from Aon. Aon is an insurance company, and Claudia is an engineer and coordinates the activity of Aon in this project. Raniero also is an engineer. He's an expert in frameworks dealing with cybersecurity and governance in general. Maria Rosaria has a background in law and is an expert in cybercrime. So I leave the floor to them for the presentation of this particular output of the project, of the PANACEA project.
Okay, thanks, Pasquale. This is Claudia. Good afternoon to everyone. So I'll start with the presentation and I'll give you a brief introduction on the general context of the governance tool and then leave the floor to my colleagues Raniero and Maria for all the technical aspects. So this is the agenda of our presentation, and in particular, I'm going to give you a general overview to underline where the PANACEA governance model fits within the PANACEA toolkit. And then my colleague Maria Rosaria will make an overview about the background literature and best practices behind the developed methodology. And Raniero will go through the technical aspect of the governance model and give you more details about the two main modules composing the model, that are the HealthCare Cybersecurity Governance Tool and the HealthCare Cybersecurity Organization Structure Model. He will show you how the tool and the model work and will provide an overview of the final outcomes, discussing the main results obtained in FPG. That is, as you know, one of the three healthcare contexts involved in our project. Of course, it's a work in progress, so we are still working on the model definition, and we already planned some refinements for the model. So we would like to catch this opportunity and to be inspired by feedbacks we may receive today from you all. Please, next slide. Okay, so I think that all of you have an idea about the final outcome of the PANACEA project. So just to contextualize our tool, the PANACEA project will deliver a solution toolkit made up of 4 technological tools and 3 organizational tools. So what we'll have at the end is a technical toolkit composed by 4 technical tools and a non-technical one composed by 3 organizational tools. The resilience governance fits within the PANACEA non-technical toolkit, together also with the 2 tools regarding nudging and training solutions that are under development. So focusing on the non-technical toolkit, the purpose is to provide concrete and actionable recommendations aimed at sector-specific executives and industry representatives and policymakers in order to strengthen the security governance of an healthcare organization. So how it will be achieved? From one side, that is the left one, through the governance model by analyzing the actual IT security governance and highlighting specific gaps. Then defining a set of guidelines for a new IT cybersecurity structure of the healthcare organization. Then, in parallel, through the tools regarding training and learning solutions, the PANACEA non-technical toolkit will explore human behaviors with respect to security policies to the whole staff of the organization, complementing to the IT structure. And it will offer also a targeted educational learning in order to stimulate behavioral changes in relation to cybersecurity at the main aim of strengthening the whole healthcare security governance system. So this is the main purpose. So please, next slide. So the PANACEA Cybersecurity Governance Model is composed by two independent and strongly related components that are the HealthCare Cybersecurity Governance Tool and the HealthCare Cybersecurity Organization Model, which are both going to be detailed in few minutes by Raniero in the next slides. So just to give a brief overview of what the model works, the tool allows to assess the information security. Oh, sorry, can you hear me? Yes. The tool allows to assess the information security management system status of the organization and to identify functions gaps that need to be improved according to the cyber risk assessment and mitigation action list. Then, the purpose of the model is to improve the information security management system status. So it is composed by a set of guidelines for designing the organization IT security structure, which refer to specific entities, processes, roles, and responsibilities, and enables a healthcare organization to identify and implement specific actions. So Yes, another important aspect I would like to underline is that the use of both components will enable an innovative way to the decision makers on how to organize an investment plan and an economic model to properly build a security governance unit. Filling gaps emerge from technical, governance, legal, and contractual point of views. And we are also working on this topic that maybe can be food for thought of the next workshop. So yes, now next slide, I leave the floor to my colleague, Maria Rosaria, that can give you a brief overview about the best practices and background literature that is behind our model. So please, Maria.
Claudia. Thank you. The framework has been created on the basis of some standard and documents in the healthcare sector, such as the Open Information Security Management Maturity Model, the National Institute of Standard and Technology, and sorry, the ISO 27001. The most evident benefits of this framework provide a comprehensive and central view of corporate security. It ranges over outside the perimeter of IT security to include people and processes, but the taxonomy used by the three standards may be different. In general, the reasons for this problem depend on the different connection to the structure of the key points of each model. Of course, we went through the harmonization of the most important terms of IT security applied globally, but it is desirable that each standard should want to keep its own taxonomy as much as possible. Next slide for Raniero.
Okay, welcome to everybody. As Maria Rosario introduced, at the moment, the state of art about the governance and cybersecurity in general have a lot of standards or guidelines that can be used, and not just the three that we propose that we have considered as the maximum aspect at the moment, but there are also any other guidelines for the specific domain. But generally speaking, what we did is to find a way to use the best of each one, and in order to have a possibility to, from one side, evaluate the posture of the governance, the security governance of the organization, but also using some main concepts that in reality are present in several different standards, but with some bit different in terms of taxonomy, but with the same goal. One of the best approach and is what has been introduced by the NIST, identifying in the security management system 5 area or family, as they say, that's will be or are decomposed in several categories, and so in more specific controls that you have to check in the organization in order to understand the status. This kind of hierarchical structure that is present in all guidelines or standards in reality may find a lot of problem, because, for example, the NIST have more than 3,000 controls to use, and the user in real difficult to select which kind of control use for their context, you know. So this one of the main problem that we try to solve was to select a right set of controls that are referred to several category or family, or what do you prefer to use in terms, but in general that's is able to evaluate the information security management system. That is the ISMS is an acronym introduced by the ISO standard, for example, and actually it's reused also from the others, from the other guidelines on standard. What we did and what we are able to do in this way, according to this selection that after I'll scroll you how we perform that, we are able to understand in each area of the NIST representation and the 5 areas of the governance that actually are acknowledged by everyone. What is the status of the organization? So, for example, as you can see in the slide, understanding which is the level of the from one side we can call compliance, but we prefer to say what is the posture status of the organization in relationship with the main function of the governance. For example, identify means a set of controls in several, let's say, category that have the main objective to understand the status from different point of view. So we select several controls or to analyze in order to specifically understand the level of the maturity from one side, but also understand the level of possible gaps to improve. Sorry. The criteria, as I said, depends on the use of the object in the assessment, and the objectives are different, and in several times we can have several control that can achieve the same objective. So one difficulty that we had was to understand how to split the set of the control in order to focus and eliminate the redundancies. Can you pass to the next? Okay. The previous slide is just an introduction, and after these three slides, I directly show you the Excel file, the tool that we use, and so I can enter more in detail in specific topic that I just introduced. The second aspect that I would like to show and to you is the aspect related to the organization. In this, for this topic, there isn't a real, state of art that is really usable to create the organization, because the standards in reality are more focused on the specific objective to achieve inside of the entire context, but don't really help to understand how to create the organization that have to implement and maintain the system, the ISMS system in reality. In this area, just one, let's say, guidelines, so, and also standard, the TOGAF standard, have some information, some guidelines to perform this, and we use this, and we create a new approach. Really, we model and design and model a way to achieve as fast as possible the creation of the organization, the security organization, that have to implement the control and maintain the security, the cybersecurity status. To do that, we use two approaches. From one side, we introduce a mechanism that we call the paradigm questions, let's say, that you can see on the left on the slide, in which we, for each control that we selected, we perform the question in order to understand who, what, where, and how this objective can be achieved. In this way, we are able to define, from one side, the people that are involved in the achievement of the objective or the controls that you need in order to have a real information security management system, but also understand where, if for example the control is inside of a real entity that's that have to perform just the security topics, or if the entity is inside of the organization, but in some way is parallel or participate to the security without a real, let's say, affiliation with the entity inside of the organization. This seems, a little problem, but in reality it's a big problem, because any kind of organization have in some way an IT structure, but for many reasons cannot be the same entity that have to manage the security. So it's important to have also a parallel entity or a new entity, a new real entity inside of the organization that perform just this topic. But at the same time, the cybersecurity is not considerable a specific entity topic, because everyone, all people have to participate to the security in relationship with the responsibility assigned. So the approach was to, from one side, with the previous tool, understand the posture, so analyze the gaps in relationship with the standard, and in a fast way in a fast way manner. So the sense was create a questionnaire that include at the moment 133 questions that are strictly related to the standards, ISO standards, NIST standard, healthcare domain standard, and so forth, in order to have a vision, perspective of the cybersecurity organization in the context. And after that, and also in parallel, using the same material, because the control are organized in terms of category that can be assimilated to the security process to put in place. We have created a model, so a way to a real flow to perform in order to understand the actors and the elements that in reality, in practical way, have to implement the control or manage control itself. I think that's maybe useful to share my screen at the moment, because I think the next slide, can you pass in the next slide? Yeah. So before to pass to Excel, in which I can show the results and also the model used, so what we developed. We use the FPG case directly to test what we developed. And so from one side, we had several, interview with elements with, entity and people of the FPG organization, in order to understand their relationship and their posture with the controls. And at the same time, FPG was able, using the model that we develop and design and develop, to define an organization of security structure inside their organization. And so taking into account the problem and also the reality of the organization that exists inside. This exercise, let's say...
Raniero, may I just clarify to the listener? FPG is Fondazione Policlinico Gemelli, is the hospital, one of the three hospitals participating to the project.
Yeah.
Sorry.
Yeah, yes. FPG was the first use case, user agency that's help us to understand if what we have in mind works, let's say. So we tested with them in real close aspect, in the sense that we perform a round table around the concept with the people, but also trying to understand if the model that we suggest really creates something. So next slide, please. And what's we achieve? We achieve a possibility, and so results to identify the posture of the FPG, for example, and in relationship with the controls and standards that we had considered, in order to understand gaps, but in the different area of the ISMS. And this help us to also to use this posture to understand where are the gaps and how these gaps can be managed. And so next slide. From one side. From the other side, the other elements of the model help us to build a structure of the cybersecurity organization inside of the organization. Next slide. So in brief, and now I think I can share my screen. We perform from one side the status, and we are actually improving the accuracy and so the information that we achieved in inserting more contextualization, a sort of maturity level of each control in order to understand more in depth, which is the corresponding remediation that we have to associate with the control, and also to understand how to insert a priority level of the each control in order to create a list of action that should be performed with these three driver, let's say. That from governance side, I mean, from system governance side point of view. From the, at the same time, this kind of information, and so this mapping, more deeper mapping with the standards, help also to understand which kind of processes and so responsibility we have to define, and also in which kind of priority we have to put that in order to create a real plan for that. Also, and I think that if I can, I would like to share my screen. Okay. 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 So to recap, what we perform. From one side, we build this list of control selected from several status, organized in category that we are directly transform in the security process that the organization have to perform. For example, the asset management already exists in some form from IT point of view. But normally is not the same things, or not considered some aspect that the security have or introduce for the asset management. So this asset management inside of any kind of governance model, security governance model, and needs to find a form of a process in general. So organizing this kind of selected category that are strictly related to category or area or other, let's say, terms used, but in reality have the same objective, help us to organize the sub-control, the control, in order to understand which is the level of the aspect, let's say, that we at the moment are considering as the security process. So each question will be evaluated in more than one step. The first step is just to understand if exist or not exist, or partially exist, something that in the context, obviously, and the organization constant, that something that is able to manage or to achieve the objective described in the control. That's help a lot to create the first overview of the status, and what we really map in order to have what I'll show you is this kind of mapping. For each control, we map the relationship with the control of the NIST, the ISO, and several other standards in order to say, okay, we are able to show you which is your posture in strictly related to, for example, NIST point perspective overview, in which are represented, your posture represented in 5 dimensions, but also the perspective that ISO standard can provide us with the same set of control. So at the same time, we are able to understand from point of view of the prospective point of view of the ISO standard that is a little bit different with the NIST perspective, for example, but using the same control because we map the relationship between controls and the different area or topic that are focusing on each standard. That's helped a lot because we are able to say from specific side the same content in the end, but let us also to have possibility to take a decision about which kind of area to improve, also using the different perspective. So coming back to the control reference, what we are actually defining and also using is a bit level more, in the sense that, okay, we because the analysis is performed using a questionnaire in reality, and so making an interview with the people of the organization to reduce, or from one other side to improve the occurrences, we also introduced a sort of decision about the level of the maturity, let's say, of the solution implemented for the control. This level is strictly related with the level introduced and described in the standard, the ISO standard, but also the TOGAF standard, and let you to understand which kind of level associated to the control, and so generally speaking to the process, you know, using a scale in relationship with the evidence performed and present in the content. Just to give you an example to explain. For example, the asset management, one of the main control is related to how the systems are identified and are managed and listed and so forth. Independently of which kind of approach you have in your organization, we can say, okay, your level is an initial level. For example, you have just an Excel file with, but you don't manage the or update this file and so forth. Or, for example, you have a software, an IDM software that's strictly related with all devices in the network, and in this system I also have a prioritization, I have a classification, and so forth. This means that your level is high. So making this kind of added question to the main question, we are able to understand the level, you know. What we are also introducing that actually is in work in progress, let's say, is understand the cost range about this control to achieve the minimum and the maximum of the level of the objective, sorry, of the control. Why this? Because in the main question is, okay, I would like to make the best. How much is the cost? in order to do that, that is really an innovative, let's say, topic, and also really difficult, because there are many solutions for the same control from one side, and from other side there are some control that is quite complicated to understand how much is the single cost, because it's not strictly related to a system, for example. Just to give you an example, to understand how much is to the cost related to creating the processes and policies, it's not so easy, because there isn't a real, let's say, cost list what we can use. But what we are doing and using, and in association with FPG, but also other hospitals, to understand how they associate cost to this kind of topic. So the steps will be understand the cost, because when we select and propose the improvement from one side, from prioritization and importance of this control in the relationship of the entire governance system, also have a view of cost of this objective, in order to have also the perspective of sustainability, let's say, because okay, I would like to perform this, and the question immediately is, how much time this kind of mitigation require, how much is the cost I am able to implement what you are saying, and the last question, what is the return of investment of this? So these are topics that we are working, and probably in the next workshop we are able to show you the outcomes. At the moment, the outcomes related to the posture of security let us to understand in which kind of area exist gaps, and so using the controls and so how to move from the minimum to the maximum, understand the set of the control, and then the process that must be put in place. And the question associated to that is, okay, who and in how, and how I can perform this. To do that, we introduce the second part of the governance tools, the PANACEA governance tools for healthcare is, okay, we have a set of things to do, but we need to understand how to put in place this, taking into account how the organization is, because in the perfect world we can build from scratch. But in the real world, we have to use as much as possible what we have, and improve what we need. So the model for the organization starts to understand and to use these paradigms, or understand who, so which kind of security roles, and so we define a minimum list, but that can be expanded if need, of the role, quindi security roles that have to take into account the objective, what process, or let's say control, or set of control we have to do, classified this kind of control or process in 5 elements that are important, because security, more than the other processes, general process, organization process, need to have a linear structure. So strategic, tactical, operational, and generic are useful to understand if the process and where the process, the security process need to be created at a different stage, in order to keep to have the real control of the security process. Also, is important to understand where in sense that because the security is not just for the security office, problem, let's say. It's an organization problem. Need to have some specific entity in which the single process have to be managed, but can have also external in sense external to the security office of the organization, but external also to interaction with external people. For example, when you have relationship with provider for some services that are important and must be controlled from security point of view, and one of the entity that is in the flow will be the provider itself. So this means to create a specific security office related to the who is the entity related to. And the last, not the least important element, to understand the level of responsibility to assign. So using this kind of the flow, and that's I introduced below an example, led to understand for each process and so category and control and sub-control the 5 aspects. Using this schema, the exercise that the FPG performed was that understand for each category who have responsibility to what, and then this mapping is the first map that help a lot to understand and to create the structure of the people from one side, security processes from the other side, strictly related to the gaps that we analyzed before, because we have the same basis, let's say, reference. So this for all element or sorry, for all function, big function of the ISMS. And without enter too much in detail, as you can see, for each category, using the paradigm, the FPG was able to understand who is the functions and the people associated, understand where in the organization, but also it was to understand how to approach the organization in the specific context, because the context that they define not means that is the same for the other organization. In this exercise, for example, they understand that because I have a lot of let me to say unit of the hospital, but it's quite important to have a reference people to us for each element, but need to be coordinated in some way. They created a virtual not so virtual, but in reality a virtual table composed by the team with people inside of each unit in order to pass and to use them as a point of reference for the cybersecurity. This was their choice, for example. But also having the same or main elements that are also present in your organization or are not exist or included or created as a new, or having a real CISO office or security office that is associated or in relationship with the DPO, so the data protection officer, and so forth. that's more or less is the idea and the outcomes that the tools from posture from one side and the model to create the organization from the other side has been tested with with FPG in that moment, we are also testing on the other hospital structure that have another kind of organization, so probably will be the different outcomes. And we are gathering these outcomes in order to understand if the model help in similar manner. Let's say, so if the level of the outcomes achieved are the same. And that's the moment. I think that we can come back to the slide, you know, if you want. So I can would like to continue with the slide, or you want to, because I have it here. So okay, we were here. So main conclusion. The main conclusion about the tools and so the researches that we performed was, from one side, we really defined a set of the controls, the basic objectives of security objectives to use in order to perform the status of the security systems in the organization. At the same time, this sets help us to understand where to put our attention, but also understand feasibility. We are working on understand the feasibility of the gaps to improve. Because it's not so, I mean, directly, we don't think that is possible to cover all and immediately. That is reasonable. So we know that it's important to understand as quickly as possible and with different level of occurrences what is the status, especially with the standard, I mean, reference, and provide as much information as possible to the user, to the decision maker, in order to select the real action to put in place with a sustainable investment plan at that moment. You know, I think that I already said everything. Okay. Pasquale, do you want to add someone else about your also experience as a FPG end user?
Yeah. No, thank you, Raniero. Just to highlight something about the organization chart that you have seen.
Yeah.
As Raniero said, the organization chart is quite situational, let's say. It depends on how your organization is already built. So the Gemelli Hospital is an hospital with 4,000 employees. It is quite big. It is a very complex organization chart. There are, in some cases, 9 levels of hierarchy, for instance. No?
Yeah.
It is very, very complex. So the effort has been to understand to understand how do we distribute the sensibility, the awareness of the cybersecurity issues in the organization. So we invented a concept with Raniero with this concept of reference persons. So they are the specific key, passepartout if you want, able to have everywhere in each clinical department, in each bioengineering department, territorial unit, to have someone that awareness on cybersecurity. So the virtual or real.
Oh, Pasquale, I think we've lost you.
I can continue.
Okay.
Can you hear
Oh,
me?
yeah, we'll be back, Pasquale.
No, yes, I was going to conclude. No, this was just to highlight this specific feature of the organization model that has been shown. We applied this model also in a multi-hospital reality, a territorial one. This is Crete, Crete, and they have a more complex, different organization. So they have territorial units, etc., with the reference people. This is the key idea. Okay.
To add more, they help to from one side as we also have in the model. So what Pasquale said, for example, is a role in inserting in the list specific information security reference person that in reality exists, and it is important because when we have to define the control and so to pass the responsibility in a hierarchical way, because the security must be in this way, we have a possibility to understand who of this organization have in terms of the responsibility, and so what have to do, and that's helpful also to understand which kind of trainings we have to perform, because we know which kind of process or objectives are related to this person, so the responsibility that we pass to them. In order to have a more manageable organization, the introduction of these people help a lot this kind of context, for example, but from the other side, required to form the people on the context. So we know that, for example, if we in detail understand that the person, the point of contact of person of each unit need to be trained on topics. We also have capability to understand which kind of training to organize and which kind of level, and so that is more or less the link with the models that will be presented in other workshop related to the how is the level sorry, of the awareness and knowledge these people has for the security context, because it's quite normal that this kind of people are not in the security domain, and but we need to use this structure, so we also need to understand which level can we achieve. Otherwise the general achievement of the objective can be not achieved, okay.
Yeah, just to add one thing, if you go back, Raniero, to the organization chart.
Okay, sorry. Okay, let me to organization chart. Yes, here.
Yes, okay. I want just to show another feature of the organization. So what you see in the center is the cybersecurity and data privacy integrated management team, and this is a operational and tactical level mainly. While at strategic level, the integration in the organization is on the upper part. the Cybersecurity and Data Privacy Committee,
Yeah.
where we have the place, no, the organizational place where we get the commitment from the top managers, so that they know what is going on, and there is a table where they can meet, discuss. This table has a secretary, and the secretary is the CISO. So the CISO is preparing the evidence, the discussions, the proposal, etc., for the committee, so that for instance they can decide the investments, for instance.
Yeah, just to remark on some a concept that I not stress it too much, but I think that's important to underline, just to also to discuss. What we Pasquale said is really important. Important is this: in security governance exists, must be, I mean, in several, studies about that, but it's important that exists an hierarchical structure of the single process with a specific, let's say, objective. For example, strategic processes are related to understand investment or not, but are related to several tactical processes that provide information about this kind of decision, and so forth in a hierarchical way. So it means that also the organization structure have to be, created in a similar manner. It means that the processes involved, the people involved in this kind of board, the cybersecurity and data privacy integrated management team will have processes about security, and so control, operation, task to do, that are different from process of this kind of table, in the Cybersecurity Data Privacy Committee, or general speaking, managed by the CISO. And the question should be, which kind of process? Well, the process associated to the control that we have to achieve. That is the driver. We know that here there are some processes that are strictly related with the general, specific, and at different level. This kind of map led to understand also how to create and monitor after the processing, the security process at the appropriate level. I think that coming back to the presentation, I think that if Claudia, you want to close or not in this way, or we want to open a discussion about
yes, I think yes, we finish with our presentation, so maybe we can just leave the floor to Stephanie for the question and answer section. I think we can just, yes.
Yeah. Well, what we do need to do, because a few participants arrived just a little bit late, I will make a quick announcement. So we have a new image ready of an event coming up at the end of the month. Because what we would like the participants to do is do a quick introduction of themselves, but we'll give them a couple of minutes to get prepared. So we'll just be asking you quickly to share your name, affiliation, and interest in PANACEA, or any relevant work that you're doing that's complementary to PANACEA. And then we'll start with that, and we'll take some questions, and we'll take some questions from the audiences and start some of the polls. What we would like to announce on the 28th, at the end of September, just going into the beginning of October, there's a virtual event organised by DG Connect, and this is the Connect University Autumn School. It's all open to any registrants. There'll be a live streaming from the Commission, and Sabina will be in the session on cybersecurity, a priority for healthcare delivery, which is on the 28th of September in the afternoon. You can get full details from the link, but if you search the web, you'll find it pretty easily. It's organised by Fruitorium. and Sabina will be talking about the PANACEA people-centric approach and the role of our toolkit in both times of pandemics and also in times of peace, as we've called it. So there'll be some frontline experiences from that as well, based on our, end user hospitals and healthcare centres, but also some additional research we've been doing. In fact, we do have a couple of questions lined up also for our partners from Aon. But then, so if I can just pass the floor now I'll stop sharing. The list that I showed at the beginning has changed because we've had some new participants joining the webinar late this morning. So we'll just open up the attendee list and we'll go through them from there. But we'll generally start in alphabetical order by surname. So thanks for this. So you've got a chance now then just to give a quick introduction to yourselves. So let me just double check the attendee list. And so we now starting by alphabetical order, we have Socrates Nifakos. If you could just say your name and where you work from and why you're interested in following this webinar series. If we can unmute him.
Yes, hello.
Hello.
Hi everyone. My name is Socrates Nifakos and I am a PhD student in cybersecurity and privacy within the healthcare sector. This is my topic and I am currently located in Sweden. So yeah, I am conducting my PhD in Karolinska Institute. So I don't know if you...
Sorry, you're completing your PhD in?
In Karolinska Institute, which is...
Oh, the Karolinska Institute,
yeah,
yes, of course,
yeah.
yes. Okay, thank you very much. So the next person on the list would be Christos. We know you gave a brief introduction at the beginning, but there are a few additional participants who have joined since then. So you could just repeat it for us. Thanks a lot.
All right, I'm Christos Danos, representing the National Technical University of Athens, who is coordinating Project Sphinx. Sphinx is a similar project to PANACEA, and we are very much interested in exchanging information and experiences between the two projects and all the other projects that are in the same network of similar Horizon 2020 efforts.
Yeah, absolutely. We totally go along with that one. Thanks very much, Christos. So it's Caxton again. If you could just do a brief introduction again of what your interest is. One being this very topic of the session. Thanks. The floor is yours, Caxton. Brief.
Can you hear me?
Yes, we can. Yes.
Yeah. From University of Greenwich. From what I've seen so far, because it's talking about cybersecurity governance model. We're working on cybersecurity risk assessments. So from my own point of view, there are some interesting things I've seen there which I believe can be applicable. So I've done some things regarding governance, where I map different standards, including COBIT, to the different controls. So this, in a way, is in line with that. So it's kind of interesting to see that, which I believe is in the right direction and helpful for the organization within the healthcare space.
Yeah, very interesting. Good to know this. The next person on our list is Geordie. Geordie, welcome. The floor is yours if you'd like to give us a brief introduction. Christina, can you try and unmute Geordie?
I did. Hi, Geordie. If you wish to make a short introduction, you can I tried to unmute your microphone, but you need to do it on your side. So just click on unmute and you will be able to talk.
Well, then if not, then we can move on to Akuden. Thank you very much.
Hello, this is Akuden, and I work for Tecnalia Research Center in Spain. I come from the cybersecurity group, and I also work in a Sphinx project dealing with risk assessment and this certification of services. And I would like to I would like to apologize for arriving late today, half an hour late. Sorry for this. But my interest in the project is to try to see the solutions that are already available, the innovations that you brought, so Sphinx can learn from your results and provide a competitive solution as well. Thank you very much.
Okay, thank you, Akuden. Okay, then, so I think we're ready now then to move on to the interactive part. Please feel free to post any questions. You can ask for clarifications or additional points about what you've heard already. We can start with that. If not, we'll start with the directly with the interactive feedback and the polling. I've got just one question, Raniero. This is, you know, all of this big organization model, and we've got some really great models in getting the making cybersecurity a top priority within an organization. But I was actually thinking about, what if I'm a small rural or a small private clinic? I might have lots of money to spend, but how do I, you know, how would I go about risk governance if I was in sort of a slightly different situation compared to what we have in our end users or amongst? It's not just to you, Renee, it's to anybody actually on the any partners or any of the, you know, your colleagues.
This question, let's say, to adapt the model to the different sides of the organization, but also capability to spend, let's say, was a question that we put to ourselves. In reality, what we perform is just most focused to understand what is important to define. That in reality, it was the security process. You understand how many processes you need to achieve the good level of the governance. In reality, the best should be less process I have to manage, better is my capability, you know. And also that is related also to how much people, how many people, how many level of the structural level I need in this context. You know, I mean, thinking of this constraint, let's say, what our position was, okay, I don't want to define a fixed structure, because in reality, any kind of organization can achieve the same goals using how is their organization, you know, and also the capability to spend money. If you have a lot of money, I can say, okay, I want to address this problem, acquiring all people needs in the context, and that's should solve the problem from one side, but it's not so. So what we think that is more important. I mean, it's much important to define the logical process to implement to achieve at the same time two goals. From one side, the objective of control, you know. From the other side, who have to do that? Because generally speaking, I mean, the state of art of the standard don't put the people at the center, you know. Say, okay, to have to achieve this objective, but how you do that and which kind of people have to perform this role is not defined, because it's really complex,
Yeah.
and it's not, let's say, from one side, it's not modeling. Okay, just the TOGAF have introduced this, because TOGAF is, historical speaking, the TOGAF standard is focused on the organization and processes, you know. So it's the only one, the only standard that think in terms of process. And in the state of art analysis, we, I mean, catch this point and say, okay, from one side, we have a strong, I mean, gap analysis in relationship with the standard, NIST, COVID, HCG, the local standard. For example, in Italy, we have also for the healthcare a standard from the healthcare domain, you know. So in the other country it doesn't exist this, and so they refer to the ISO or the NISA and so forth. And so the first approach was, okay, we have understanding that they suggest us to do this objective control, blah, blah, blah. But the problem to understand who and in which kind of time are able to perform this objective is not defined.
Yeah.
I mean, okay, so the problem that we try to solve in this project, and also the experience, the SPG, was to understand, okay, independently of your big contest, we want to define a simpler way. And the simpler way is, we know with the standard that is applicable independently of your organization complexity, because the same questionnaire is performed to any kind of organization, you know, independently. But the result needs to be I mean, structured in a system that is completely new to create. This little part, we created this kind of approach that I think helps a lot. So we don't provide a structural model. We provide just the element, so a real model and flow that you need to use in order to build the organization. And in this way, with the other two entity, we are trying to understand if the outcomes are the same, because they are different also in terms of organization. For example, the Ireland structure is different with the in the same domain, but it's different structure in terms of organization. And what we are analyzing at the moment, that's in the end, they have less people, but more or less the same role, but in a simplified structure, because the organization is more easy. Okay, if I can use these terms.
Yeah. Well, in fact, there are lots of national, across Europe, lots of national fragmentation, because we have different approaches. But this is obviously something that PANACEA needs to take on board, as well as the skill shortage that we have in Europe today in terms of professionals. But we have a question for you. So, Pasquale, maybe you'd like to ask that question. This is about the standards and NIST. So the floor is yours.
Oh, this is for
See, for us, yes, I can answer immediately. We not select just the NIST, the ISO. In reality, we at the final we decided to use NIST and ISO because I don't know if I can share my screen. Yes, I think, just to answer directly to the question. In the Excel that we perform. The list of control, in reality, we map also, for example, with the COVID, but also with the CIS and the other local standard and so forth, the GDPR, in order to have all of these standard with the same pool of the control. Because some standard have more specific for example, in some area of the NIST representation, are more, are more specific defined, but in the other area not. So what we perform is a real map of all possible standards, also the healthcare, for example, just to, I think that I said, but we added to our list 13 control that are specific for the healthcare that we found in the guidelines or standard for this domain that wasn't considered in the other in the other control. Just to give you an example, the medical devices. So the restriction that the healthcare domain impose for the medical devices, if you try to find this control in ISO or in NIST, probably you don't find this. So we understood that for this specific element of the security, because there is a system inside of this context, we insert this control. So to answer, finally, to answer, we decide NIST and ISO because are in reality as the more comprehensive element. From one side, NIST is not a standard, but is a guidelines. So means that you can follow, but don't provide you a certification. While the ISO is a standard that provides you a certification. And in the future, the continuous developing on the ISO family will be more in deep and more exhaustive, and in my opinion will be the main reference standard because it's able to provide you a certification, you know. So the completeness is the answer. ISO and NIST together, let's say, provide a completeness in terms of capability to understand gaps from the different perspective of the governance, you know. Better than the other standards or guidelines that are for several reasons specific for a part of this. Understand? I think. I hope that.
Yeah, I think that's pretty clear. Yeah, good one.
Raniero, sorry, may I ask you one thing? What is the relationship, I mean, between the NIST, ISO, etc., and the European directive, no, on the critical infrastructure for cybersecurity perspective?
Okay. Oh, okay. There are also several, I mean, documents that provide the difference between. We also insert in our deliverables the difference between NIST and ISO. In reality, doesn't exist a real difference. It's just a question of taxonomy in several ways, because the NIST, generally speaking, have more than 3,000 controls that are also specific for domain. An entire section of the NIST controls are related to the critical infrastructure, for example, energy specifically, because it starts from that. So there are a lot of controls that you can take into account in order to have a maximum level that you want, but are really, really a lot. We are talking about more than 300 controls, sorry, to understand. And if and each control have an objective. But in reality, a lot of these objectives are so specific that are not useful to understand the posture. Because the most important thing in the first stage is understand where are the gaps in terms of the macro area and the second level, let's say, processes, important processes. After that, you can enter in the deep and also expand. But if you don't know what is your status, just to give you an example, about the process to manage the asset of the organization, why I have to understand if I am able to analyze this specific topic related to the specific objective without less the entire vision. The main difference between NIST and the other standard is that NIST is really, really specific. Start from the specific, You know, so you have a lot control to select, but leave you the choice to which kind of controls to select. Don't impose nothing. In the other side, then the ISO perform because it's built to achieve certification. Have to be more practical. Okay, so impose you some controls, impose you some aspect. And the difference is the level of the details. That is the real difference. But we find, as I showed before, that exist a lot of control that are present in both lists, let's say, and exist a strict relation. You know, I don't know if I completely answer your question, Pasquale.
Yes. Okay. Now, I ask now to the person that who has put the question whether you are satisfied or you want to elaborate more, because it is interesting as a question. So please help us in getting
I mean, just to finalize, the real decision to use these two and also a third, but these two is because one is a real guidelines, completely the NIST, let's say, that have all what you want, okay, but is a guidelines. The other side, the ISO, it's a way in which in the future you will have a certification. That is quite different, you know, exists a real different from guideline, follow guidelines, or have a certification from an external authorities, you know.
Okay.
So
okay. However, the question was more about COBIT. So
COBIT, we also used COBIT because in reality we include also the control. How is I shared with you, for example, an example. One control that's is also present in the COBIT and relation in which kind of element of the COBIT description is present. So in reality we included also them.
Okay, so I ask because I can't understand who is asking the question, because I see anonymous standard. I don't know why. So
I have just asked if the person who asked the question would like to add anything.
Yes,
if they put their hand up, then we can get past them for to them.
Hello, apologies, it's Caxton. I think I.
Sorry.
Yeah.
Okay.
It's interesting. I think he's answered the question, because from his slide, I think there is a place where it was specified as NIST ISO 27001, and he mentioned three focus from that particular aspect, which they've used in creating their framework. So I wanted to know the reason why COBIT is not selected, but he's explained that, which is fair enough. But I would have suggested that if COBIT is obviously included, meaning the name for that framework which is selected should carry NIST ISO 27001 and COBIT.
Well, to answer is actually, this is just from my experience in the field, in the sense that my work is a consultant or a risk consultant. So the customers are more interested to understand your posture. My experience, obviously, my customers at the moment are more interested to understand their posture to the ISO standard and the NIST from one side. The critical infrastructure, for example, in reality are more focused on the NIST because the directive in several countries are reference for the NIST directly or indirectly. So in reality, they want to have this kind of perspective and status. But what we try to do is to have a the independent set of control that can be mapped in several, as I shared with you before we are also able to understand the posture with the, for example, Italian edged standard that is used in the healthcare domain, because it's quite possible, and so it's quite sure that the hospital can ask us to have an overview in relationship with that standard. So this is one topic that we already included. It's just to understand how you want to present the posture in reality. But obviously, as you said, we need to map, you know, the control, and that is the real the complexity is in the terms used. In the taxonomy at the upper level, not the control level, because in general speaking, the control, the low level have the same goals, more or less, but you can have the categorization different, you know, and so that is the real difference. But if you think, well, in deep, it's just a question of taxonomy that you are using for the same aggregation, you know, of the control. So I think that is not complicated. At the moment, we adapt our sets so with this main, because it's the most reference requested by the user, you know. But this doesn't mean that we are not able to provide the same, I mean, overview of the security governance structure with the other standard, because we are using the same control at the end.
Yeah, that's fair enough. I mean, from a consultant's perspective, since you're working with different organizations and within different domain, I think the NIST and the ISO 27001 stands out. Both of them stand out, yeah. That's fair enough, thanks.
You're welcome.
Okay, thank you, Caxton. Are there other questions to clarify what we have said? What Raniero has
I have one more question, sorry.
Please.
Yeah, in line with the mapping, I didn't see HIPAA or high tech. Do you want to tell us if there's any relationship between, or if you consider those two while carrying out this particular project?
I'm sorry, I lost some words in the middle. Okay. HIPAA, what you are referring?
Can
you write briefly the key concept?
Okay, I'll do that now.
Yes.
I'll go with the next question.
Sorry for it, because the communication is not so
clear. All right.
So clear, yes.
I can proceed with the next question. I'll just write that and send it across.
Okay, no problem.
In the meantime, if there are other questions, you please write them so we can write, and then we move to the feedback part. Caxton, just few words. not a romance or a novel.
Yeah. But why Caxton's writing the questions, I suggest that Christina launches the first two really quick surveys that we were meant to do at the beginning, but we were waiting for people to join. So I suggest you do that, and we give Caxton a few more minutes to formulate his questions, and anyone else who would like to do it. Okay.
No. Here is the question. Here is the question. Raniero, can you read it?
The high HPAA and the high tech in the project. Okay, I don't remember the acronyms, but I try to understand in which in the project, in sense in the PANACEA project, you are saying, or in the specific topic, because.
Okay, I'll say in the specific topic, because you're talking about governance, right? So you're mapping different standards as well as framework. So HIPAA is a framework for healthcare, as well as high tech. So I wanted to know if you consider.
No, yes, yes, sorry. Yes, we consider several standards for the healthcare. We described this in our deliverables. In fact, as I said before, several controls we added with a basic list. We added a specific control related to the healthcare standard. If I remember well, I can show with you. We share with you because I have on the hands the deliverables. Just to put the appropriate section, and related to the healthcare. Let's say
Raniero.
here, okay.
Yes, okay, yes, chapter 4.
Chapter 4, I'm trying to find, yes, for example, main reference, we use, using obviously the expertise in expert in the domain. We use this standard and also other standard, ETSI, and mandate for European standardization for the healthcare, and so several standards where we from which we select some control to add it to the list. So in reality, we already added, you know. So sorry if I don't added the complete list, but the specific reference ingredients and guidelines for the cybersecurity in healthcare domain we took into account. What we also obviously we showed that's a lot of this standard already considered something that is already described in ISO or in the other previous standard. Let me to say, you know, but for some specific regulation, for example, you know, that are specific for the topic or the domain, the medical device, for example, have something that in the main standards are not considered, you know, or don't find a specific objective, and so we introduced that and we added, you know. In the future, probably we want to continue to add something that is specific from the domain. But it's important to understand that the main reference, NIST and ISO, that's obviously are started before of this kind of the work, the job around the healthcare domain already contain something. But
Raniero, if you go at the end of the paragraph 4.3, you find exactly the high PEA.
This deliverable isn't one of our public ones, though, Pasquale. So
this is not public. This is not public.
Yeah, not public. The only thing that we are also considering that some, because we are in Europe, and also, for example, the NIST in reality, but are related to the United States, the country and domain. So we have to understand what is really applicable in Europe or not. So it's important as a reference, let's say, or model. But for example, the same topic can be, I mean, managed by the NISA, for example, for the Europe. So we have also to understand if there are some reference or standard in the USA that have the corresponding element in Europe, let's say. So for our research, we take into account, as you can see.
No, may I ask one thing about the other high tech, because I'm not an expert, so I could not find it in our list.
No, I think that are not has not been taken into account by the expert.
I would take this suggestion now from Caxton, and then just to check now whether there is something interesting for us. Okay.
Yeah,
so I think that this could be. Thanks, Caxton, for suggesting also high tech.
Yeah. Yes. Thank you.
Thanks a lot, Caxton.
Thank you.
Thank you, Caxton.
Okay.
Okay, so now I think that if there are no more questions, in order to understand what we have explained, the next step is to get your feedback on what we have produced and shown, described to you. And so we have prepared a poll, a questionnaire, and we launch it now. And it is made up of some questions, and we will go through them. We ask you to answer. And then according to what the result of the poll, we can, if needed, go a bit in depth to ask your feedback in a more, let's say, unstructured format. So I leave the floor to Stephanie.
Yeah, first of all, we need to do the 2 quick stakeholder surveys, but they're
yes,
really
yes.
quick. Yeah, Christina,
Yes.
you can go and launch them, and then we'll go straight into the other surveys.
Okay.
Thanks a lot.
Okay.
Hi, and thank you for joining. I'm Christine, and I will be guiding you through the polls. So the first 2 polls, as Stephanie was mentioning, are just for profiling. So I'm now launching the first one. There's 2 of them because the number of options is limited. So I will go with the first one. Which type of organization are you representing? So you should be able to see now the poll on your screen, and you can start voting. We'll give you a few seconds, a minute, let's say. Okay, so we are just missing 1 vote.
There is also other at the end of the list.
Sorry, Pasquale, could you repeat? I had an issue with my microphone.
Yes, I mean, there is also other at the end of the list. Yes. You have to scroll the list because it...
Okay, so I think we can end the first poll, if you agree, Steph.
Yes, go ahead, Christina. Yeah. Mm-hmm.
And I will now share the results with you. So as you can see, it's 100% view from research organization. I am going to launch the second poll. What is your role or field of expertise relevant for the workshop? And again, as Pasquale was mentioning, you can scroll down because there are more options on the screen. And you can start voting. And if none of the options is applicable to you, please just vote for others so we know when to end the poll. Thank you. Okay, thanks a lot. So I'm now going to end this poll and to share the results with you. So again, 100%. Your role is the role of researcher. So
it's consistent.
Yes.
Okay.
Okay, so now we can go on with the feedback polls.
Yes, exactly.
Just to note that these feedback polls are, one is a general, about this first one about fine tuning, then we will ask you to give your general overviews of the solution that we've been discussing this afternoon, and then the final set of questions will ask you about how innovative it is compared to other solutions that you know about or that you are actually working on maybe. So let's start with the first one. Over to you, Christina.
Thank you, Steph. So first of all, I see the majority of you already voted. Based on your role and field of expertise, would you suggest some fine-tuning to the solution presented? We're missing just one vote. or I will close the poll in a few seconds. Okay, so I guess we can share the results now. I see some of you, 50% have some suggestions. So I don't know, Pasquale, whether you want to.
Yes, if two of you have some suggestions, you are invited to provide now these suggestions. So if you could do this now, this could be useful for us.
By the way, if you want to share your suggestions now, you are already unmuted. So if you want to talk, just unmute the microphone on your side. We gave you the right to talk on Zoom, so feel free.
This is Coxton. Can you hear me?
Yes.
Yes.
Yeah, I think overall is a very good governance model. But what I would say is from a research perspective is advisable to look at it holistically. That is the different frameworks or ISO standards relating to cybersecurity or IT or healthcare. I don't know if that makes sense.
Okay. I think that now probably the best thing now is to go on with the poll, with the questions, and then at the end we open a discussion, because you will see we ask you more questions on what you have seen. You know, so let's try and go on in this way. Okay. So thanks, Caxton. So that Christina, I would go on with this section for. Of the poll?
Yes. So I'm going to launch the next poll on fit for purpose. Based on your role and field of expertise, what do you think of PANACEA solution in terms of the usability by intended user? Is it difficult to use or usable with some effort, or very easy to use? You can start voting.
I can answer.
No.
No. Why not? Well,
Hosted panelists cannot vote.
There is conflict of interest.
No, it's an objective. It's not a conflict. It's the main objective, but obviously it's quite difficult to achieve. I mean, we try to.
Let's see what our friends say.
Well, obviously it's also complicated to demonstrate, because in reality we don't have I mean, we explain what we perform.
Daniele, let them answer.
Why not? I want to. I'm joking, just to close.
Okay, for voting, I'm going to end the poll and we'll share the results. Okay, it seems that all of you agree that it is usable with some effort. If you agree, I can go on with the next poll.
Yes, move on. So yeah, this is an overall view of PANACEA, but from a slightly different perspective. There we go. Thanks, Christina.
Thanks, Steph. Question this time is, based on your role, how do you rate this solution in terms of its usefulness? Are there any current issues or not very helpful? It may solve some issues, or is it very useful? Okay, if there aren't any other votes, I will close the poll here. We have 3 people out of 5 who voted. And I'm going to share the results. Okay, so this time there's 67% agreement that it may solve some issues and 33% it is very useful. Thank you for voting. And now we'll go into the next poll.
So sorry, here I see that there is some suspended opinion, no? Because I see that there are 3 voters. There are doubts on voting on this. This is my understanding.
Well, it isn't obligatory to vote, but
No, yes,
encouraging
I know.
it. Yeah.
We are not. Okay. Okay.
Thank you, Pasquale. I'll go on with the next one. Based on your role and field of expertise, how well do you think it captures the specific aspects of healthcare environments? So you can already start voting. The options are, it's a specific, it doesn't capture any specific aspects, or it captures many, but not all of the specific aspects, or it fully captures the specific aspects.
Just to tell you about what we mean with specific in this case is about, for instance, the existence of the medical devices, for instance, no? And the fact that in the organizations there is not only the IT information system, but also the biomedical engineering in the hospital, for instance. And there are many staff that are distributed, many staff that are distributed that give to the cybersecurity a low priority because they perform the main mission, the mission of the life, I mean, no? Meaning to save the lives of their patients. So these are the example of specificities.
Are you including also the social aspect, the social engineering, cyber hygiene, awareness? Is it also included in the specific aspects or not?
Raniero?
Yes, but indirectly, because some specific data are, contributed to. In the sense that, for example, the behaviors and social engineering about are considering in several processes indirectly because you analyze the components of these action, of these elements, are not directly put inside of the contest, but will be, can be found.
I will tell something more because this is an interesting question, and I will tell something more after the poll.
Yeah.
Okay,
sorry,
thank you.
Sorry, I really have a bad connection. I don't understand what you said, Pasquale. But...
No, I said that I will give them some more details later.
Okay.
To explain how in the project we take care of the social aspects. With the DRMP, for instance.
Generally speaking, inside the entire project, yes. In the specific contest, we have indirectly connection. That's the first and the fast answer. Let's say.
Yeah.
Okay, thank you. Maybe I can go on and share the results of this poll. 4 of you voted, so according to 75%, the solution captures many but not all of the specific aspects. And 25%, so 1 person voted the 4th option, it fully captures the specific aspects.
Yes. Okay, so let me add something about the PANACEA project and what it does in order to capture the social and human aspect in more detail. As Raniero said, with this tool, with the governance tool that we've described to you, there is an indirect assessment of these aspects. However, the toolkit as a whole as another, includes also another tool that is called DRMP, Dynamic Risk Assessment tool, where we assess the status of the vulnerability of the social and the human layer, let's say. We have identified that we read the reality of the hospital, for instance, using a 4-layer model. The first layer is the IT and the network, etc., including the medical devices. Another layer is the access layer, meaning the credentials to access a human layer, meaning the individuals that work in the organization, including the relationship among them, so the formal and informal relationship. And then we have a 4th layer, it is a process layer, meaning that we consider where person A, which application, information technology, asset or device uses, in which process. And then we analyze the vulnerability of each layer. This means that on the social side, on the human side, we have a very specific assessment done through this tool. This requires that we have questionnaires to profile the people, etc., in terms of their a priori, let's say, vulnerability according to some characteristics based on their past behavior, but also, for instance, on the fact that they got some training, for instance, on cybersecurity and so on. So this is to give you an answer with regard to how we cope in the project and with our toolkit with the social aspect. That is a distinctive feature of the project. However, what you said, your question was good and was to the point, because de facto this governance tool indirectly take care of this social aspect, but not directly. However, in integrated manner, our toolkit is able to check very well also the social aspect in principle. We will see what happens when we finish the development. So thank you for this. I hope I have clarified the point.
Yes, thank you, Pasquale. Thank you.
Thanks.
Thank you, Pasquale. Can I go on with the next poll?
Yeah.
Okay, so based on your role and field of expertise, how do you rate the solution in terms of completeness of functions? It has low coverage, it has partial coverage, but some key ones are missing, or it has full coverage of all key functions?
And what do we mean here about key functions, if you could?
Here we meant, this is a governance, let's say, tool, no? It has 2 components, and these 2 components cover an assessment part and provide also an organizational framework to solve the issues. So in this case, we have, if you want, 2 functions. One is the assessment function, the other one is the organizational function. Maybe from when you decided to attend this workshop, maybe you expected something more or different. It is interesting to understand whether you found that what we presented is satisfactory in terms of completeness or not, with respect to your expectations, if you want.
Okay.
Okay, thank you. We have 3 out of 4 votes now, but I think I can already close the poll, as it's now 1.5 minutes. So I'm going to share the results. Okay, so 100% of the three of you voted that it has full coverage of all key functions.
Okay, thanks.
Okay, This poll concerns the value added versus the state of the art. And we're going to ask you, based on your role and field of expertise, to rank the solution in terms of its innovations compared with others that you are already aware of. Options are: it's behind others, it's like others, somewhat innovative, or it is very innovative.
Yeah, so these next set of questions are all about PANACEA versus what's already on the market, what's already available. Okay, now we just have a few more questions now.
Yeah, this is a comparative stance.
Yeah. Mm-hmm.
Yes.
Okay, thank you for voting. I'm going to share the results. We have 50%, it's somewhat innovative, and the 25% who think that it's like other solution, or 25% it is. I'm going to the next one. This time we're asking you to rank, based on your role or field of expertise, the solution in terms of its usability by intended users compared with others that you're aware of. I read the options, but you can already start voting. Options are: it is less usable, it has the same usability, it is a bit more usable, or it is definitely more usable. Okay, thank you all for voting. We have a 75% of you thinking that it is a bit more usable, and 25% it is definitely more usable. Going on to the next poll, again on value added and the state of the art versus the state of the art. This time we ask you to rank the solution in terms of its usefulness compared with others that you are aware of. It is less useful, on the same level, a bit more useful, or definitely more useful.
Christina, I can't see the.
Oh, I'm sorry. Can you see it now?
Yeah, here it comes. Thanks a lot. We do actually have a 100% of voters.
Yes, thank you, Steph. Can you see the results?
Not yet. Yes.
So,
okay, good.
Still more useful. And this is the last question. Based on your role and field of expertise, how would you rank the solution in terms of its completeness of functions compared with others you're aware of? It is less complete or similar to others, a bit more complete, or definitely more complete?
Yeah, and this goes back to the point that we were making before about the functions that you would expect in such a solution.
We're now missing just one vote, but I wait a few more seconds.
It's neck and neck. Oh, just yeah. That's that final vote tipped the scales a little bit. But yes.
Sorry, Steph.
I said that final vote made that little bit of difference. It was 50-50. Okay, good.
I'm going to share the results now. So 67% find it appear a bit more complete, and 33% definitely more complete.
There is someone that is always very generous with us.
Yeah.
Okay.
But it's not one of us. It's not one of us.
And so, no, no, it is not. Erkuden, she has not voted until now. This last one. Okay. So first I thank you for the feedback you have given. And if you want to make a free will observation, it's up to you. Who is willing to express at a holistic point of view on what you have seen today? Maybe Caxton has already spoken. May I ask also, so Christos, I don't know whether you want to speak, or Erkuden, sorry.
No, I'm fine, I'm covered.
Okay, good. Socrates?
Yes, me too. I'm looking forward for your final results in this project.
Okay, good. Take care. Consider that we will do another workshop in the spring next year, where once we have finished the development, also taking care of your feedback, and we are going to launch the validation, because all the things that you have seen have been, let's say, partially validated in the realities. But for instance, the organization chart that you have seen for the Gemelli Hospital has not been yet implemented. So we will try to see what happens if we try to implement it in the hospital. And you can imagine that we will find resistances, no? And issues. So we will check how much is acceptable by the people who operate in the organizations. Or even if obviously we have defined it interacting with some of the stakeholders internal to the organization. Okay, also Erkuden, do you have some, if you want to give us unstructured feedback or holistic feedback?
Yes, well, I was not able to watch the beginning of the presentation, sorry for this, but I think that the tool, you need to, let's say, get more focused on who is the user of the tool, in the sense that does the tool allow a hospital to know to what extent the ISO standard could be pre-certified, let's say like internal pre-certification of the standard, or is it dedicated to how and who needs to implement the measures to fulfill the controls? So for me, there are like two different purposes. One is like self-assessment of the compliance of a particular standard, and the other one is more related about how and who should do something to fulfill the standard. And I think
okay. No, let me give you the answer. No, the organization is built in a way that the people and the roles in the organization take care of the entire cycle. This means that they do the assessment and they analyze what comes out from the assessment, I mean the application of the first tool, let's say, and then they are also involved in implementing the measures. And the idea is that the organization is ready and do this, to do everything. So this is the idea. So the roles are not only limited to the implementation or only limited to the assessment, but they cover all what must be done in order to ensure for the hospital and to maintain the cybersecurity, to become cyber secure and to maintain the cybersecurity in the time.
Mm-hmm. And another comment is about about the role in this organization chart, the role of forensic investigators. I mean, once an incident occurs, like these ransomware attacks in the UK hospitals, these people, are they under the governance of the CISO, of the security officer? Or?
Yeah, yes,
Yes.
because there are people strictly related to the staff of the CISO in general speaking, you know, or the cybersecurity SOC manager if exists a SOC in the organization, but are also strictly related with the organization. In my also experience, some of these figure, for example, are external, but are in strict relationship with the CISO, that are not present in the organization in the sense that are not directly employee of the organization, but are external because the organization decide to have it externally. You know, that is the sense. So that is the reason, because we put the minimum people that is important for the structure, but that can be expanded in relationship with how the organization think to implement, because also the domain take I mean an important element, you know.
Okay, thank you. Yes.
Yeah, it would be interesting, perhaps, you know, next year, if we could bring in some direct experiences from the end users, you know, implementing not just this solution, but the other tools as well. Yeah, I think that would be interesting. And perhaps comparing them, because, you know, as I said, you know, we have different types of health organizations. Some of them have these roles covered, some of them don't. There might be budget issues, there might be just a simple lack of understanding, even of the legal and technical requirements under European legislations about what the obligations are. You know, we're talking in Europe, you know, 27 different countries. So I think this is definitely discussion to be picked up into the future. Yeah. Pasquale, I don't know if there's anything else we want.
Yes,
to
I want to add one thing. As we have seen, Raniero showed the list of the controls, no? And to each control was associated also the amount of money, an estimation, let's say, that is needed to make this control alive, no? This is this element, this cost element, is an important part in our approach, because it is the link between this tool that we have illustrated and another tool that we are developing in the project that is called return on investment methodology. The purpose of this methodology will be to support the top management, decision makers, in deciding how much, what to do in terms of investment for the cybersecurity. And this type of analysis, this type of methodology is based on these controls and also on these amount of money related to the controls. In the next spring, spring next year, when we show the final result of the project, to be yet validated, but we will show also this methodology, so that the governance will be, let's say, enriched with other this other component, the ROI, return on investment methodology evaluation. No, is it Raniero? Okay, so I think
Yes.
that on our side, maybe we can close. Unless Raniero, if Claudia, you want to add other things.
Well, just to underline what you are saying, we are also trying to understand how many other features we can add to what we develop. One of these is most important is the ROI, the ROA evaluation, in order to provide to the decision maker more elements to how to perform the real implementation of the system and structure for the security governance. Let's say, just to close it. But obviously, we need to ask you if you will be present in the next workshop in order to have your feedback.
Next time.
Yeah.
Yeah.
So we hope you found it interesting today.
Yeah, and open a window for the future.
Also for the resistance.
Yeah.
Also for your resistance. Sorry.
Thanks.
Yeah. I'd also like to say a thank you as well from our side. So, let me just show you quickly. I showed this yesterday, but I'll just give you as a reminder. This is one also perhaps for Sphinx and other peer projects that you can contribute your research papers or your findings to our Lookout Watch, because this covers cybersecurity and health from different perspectives, also from including policy guidelines, and soon an overview of the standards landscape and how PANACEA is contributing to it. And obviously we can feed in also your feedback over the next week or two through this virtual workshop. But you can also join us on LinkedIn and on Twitter. But we do also, really do look forward to engaging with you again and looking at ways in which we can build on the synergies and on the results sharing and joint dissemination also with our peer projects in Europe. So thanks again. Stay safe, and hope to speak to you again in the near future. Bye for now.
Thank you so much.
Thank you.
You were your screen, so maybe if you want to show these slides where we have all the address, the LinkedIn.
Oh, sorry, I thought I had my.
No, I tried to tell you, but.
Sorry, I could think because you're showing the. I think if you close the poll, because I think the poll. I can see the poll still, Christina.
Okay.
No, now there is the slides.
Yeah, the slides are there. Let me just put it up a bit bigger. So this is our Lookout Watch. I'm still seeing the poll. I've closed it myself. Okay, so this is our LinkedIn community and our Twitter account. You can, if you click on the link to the Lookout Watch, you can find all the details of how to contribute to that. So, please stay in touch with us and let's continue the discussions and share results and see where we are. This is a key policy priority area for Europe. So let's see how each of us are contributing and joining forces whenever we can. Okay, to maximise on the impacts with the resources that we have available. So thanks again. Stay safe, everybody. Take care. Bye for now. Thanks everyone on the PANACEA side. Bye.
Bye bye.
Bye.
Thanks a lot. Bye-bye.
Bye.
Bye-bye.
Bye.